For the love of your lumbar spine, please stop doing glute bridges and pelvic curls if you cannot properly stabilize your pelvis. I'm going to tell you why and what you can do instead. I've already gone over pelvic tucks for stability. So building off of that, we're going to talk about your glutes. Because yes, strengthening your deep core and your glutes is one of the best ways to help relieve and manage and reduce low back pain, but how you do it matters. When it comes to muscles we can't activate if we can't isolate, and we can't isolate our glutes if we don't have the deep core strength to stabilize our pelvis. Without these in place, muscles will compensate, overcompensate. This is what leads to both muscle imbalances and potential injuries. To isolate and activate the glutes, we want to do it without overloading the lumbar spine. We also want to eliminate as many synergistic muscles as possible, meaning the other muscles that may be working with the glutes. And then a couple of other principles that are important. The glutes like to work when they are in hip extension or a posterior tuck, so think when your leg is moving behind you. Glutes also like to work in external rotation, movement of opening your hips or pulling your leg away from your body. This is why the 2 moves I included in that 10-minute bed workout for the glutes are in a prone position. This is also why we started with pelvic stability, with activating those muscles and getting ourselves used to holding the pelvis in a tuck before we then transition into this movement for the glutes. First move in the workout is a single leg extension with the legs externally rotated. Using both of those principles with the external rotation to get into the glutes, this is the same reason we would do clamshells. Again, starting with that posterior tuck. So we're already starting to recruit the gluteal muscles before we even begin trying to lift the leg. And the prone frog hold is utilizing those same principles, external rotation of the hips. This one, though, we are getting the hamstrings a little bit more involved. If you have hamstrings that cramp easily, this one may not be the one for you. Now that we've talked about those principles and then showed it in practice, I want to take a look at glute bridges again. There are 5 other reasons I prefer the prone work to traditional glute bridges, but we needed to get that out of the way first. The first is it takes more deep core strength to hold your pelvis in a posterior tuck as soon as it's lifted off of the ground. If you already struggle with pelvic stability, deep core strength, we're increasing the challenge to begin with. And what's going to get compromised? The lumbar spine. Second is glute bridges and pelvic curls can be hard on the knees and the cervical spine depending on the person. 3 is that glute bridges and pelvic curls also inherently involve the quadriceps, and if you have quad dominance, anything where you have the quadriceps involved is going to confuse the body and just make it harder to get into the glutes to begin with. 4th is that it requires a certain amount of length in your hip flexors to be able to push your pelvis into that posterior while you're also elevated. For example, if you have an anterior tilt, you may not have that length in your hip flexors because they're shortened, or if you have a tight rectus femoris muscle, which is the only muscle that attaches over the knee and the hip joint, regardless of what kind of tilt you have, if that muscle is tight, you're going to struggle to push all the way up there, in which case you're not really going to get your glutes activated and we're just going to create a bunch of pain and tension. 5th, I just find that it's generally easier for myself and other people to breathe through movement when their chest is not lifted above their chin. You do struggle with breathing through movement, and especially if you struggle with breathing through isometric contractions, that's just something to consider. I ran out of time today. Next week, I'll go over the 2 glute moves in a little bit more detail, and I'll just show you some other ways that you can modify, assist, and adjust this to make it work for your body. See you next time for that one.